Accidents and safety rules. Have you or your friends ever suffered an injury? Can you recall why that happened? Do you think that being a little more attentive, careful and cautious could have saved that injury or accident? An accident is a sudden, unexpected and harmful incident. It causes pain, injury and may even lead to death. Most accidents occur due to carelessness. Accidents can be prevented if we observe simple safety rules and be more careful and alert. The safety requirements for different places and situations are different. Let us learn the basic safety rules to be followed at various places to ensure our safety. Road safety. Road accidents are the most common type of accidents, especially in big cities. Each year, several thousand people are injured in road accidents all over the world. Road accidents are caused due to rash and negligent driving or disobeying traffic rules. Are you aware of the road signs and their meanings? The road signs make us aware of the conditions of the road and give information about what lies ahead. These signs also convey certain rules to be followed by us while using the road. Some rules to be followed by pedestrians. Always walk on the footpath. If there is no footpath, walk on the right side of the road. Look carefully both ways, first right and then left, for any coming traffic before crossing the road. Do not play or run on the road. Avoid using mobile phone even while walking on the road. Fire safety. Electric sparks, leakage of cooking gas, petrol, firecrackers, etc. can cause fire accidents. Some rules to be followed for fire safety. In case of leakage of cooking gas, open all doors and windows to let the gas escape. Do not light a matchstick or a candle. Never switch on or off any electrical appliance before the gas escapes, as it may ignite a fire. Wear cotton clothes while cooking. Do not wear nylon clothes as they catch fire easily. Never wear loosely hanging clothes while in kitchen. Fire caused by petrol should be put out by throwing sand instead of water. Petrol, being lighter than water, floats on water and continues to burn. Never throw water over a fire caused by electricity, since water is a good conductor of electricity and you may get an electric shock. Small fires can be extinguished by throwing sand over them. Fire extinguishers can be used to put out big fires. Firecrackers should be lighted with proper attention and precautions in the presence of elders. Never play with matchsticks, candles, and diyas. If somebody catches fire, do not let him run around as the air would fan the flames. Instead, make him roll on the floor or cover with a blanket or thick and wet bedsheet immediately. This would cut the air supply and extinguish the fire. First aid. The immediate help given to an injured person before the arrival of a doctor or medical aid is called first aid. Let us learn the ways to deal with certain accidents or emergencies. Burns. The burnt area becomes very sensitive as the outer protective layer of the skin gets damaged. Germs can easily enter through the burnt area. First aid for burns. Wash the burnt area with water. In case of chemical burns, wash the burnt area with lots of water. Blisters, which are watery eruptions on the burnt skin, should not be pricked. Pricking can cause infection. Apply a piece of cloth dipped in a mixture of baking soda and water to the burnt area. Apply an antiseptic cream to the burnt area. Cuts and wounds. Cuts and wounds expose the body tissues to the air. This allows germs to cause infections if proper attention is not paid to them. First aid for cuts and wounds. Clean the wound with an antiseptic solution like Dettol. Apply an antiseptic cream to the wound. Put a pad of sterilized gauze over the wound. If bleeding does not stop, tie a tight band above the wound to stop bleeding. An ice pack can be effectively used to stop bleeding. An ice pack can be prepared by taking some crushed ice in a thick wet towel. In case of excessive bleeding, make the victim lie down and raise the bleeding part at a higher level than the rest of the body. If the skin is cut by a dirty or rusted object, germs may enter and cause tetanus. In such a case, an anti-tetanus injection should be given within 24 hours of the injury. Sprains and fractures. Injuries to muscles and bones are quite common. A sprain is a condition where the tissue around a joint gets torn due to a sudden jerk. It results in a painful swelling with discoloration of the skin. The common injury to the bones is a fracture. Fracture is a crack or break in a bone. First aid for sprain and fracture. Apply ice pack on the affected area. Do not allow the movement of the affected part. Tie a crepe bandage or a splint to prevent further movement. Give complete rest to affected part. Take the patient to the doctor immediately after first aid. Get an X-ray done to confirm and locate the fracture. Animal bite. When an animal bites, germs of various diseases can enter the victim's body. First aid for animal bite. Wash the wound with soap and lots of water, as the saliva of animals contains deadly germs. Apply an antiseptic cream or lotion and tie a bandage to prevent infection. Take the victim to the doctor. In case of insects like honeybee or wasp bite, scrape the sting with the edge of a clean object and wash the wound with soap. The chemical released by most insect bites is partially neutralized by soap. Apply an antiseptic ointment after the wash. Snake bite. Snake bite like that of a cobra or viper can prove to be fatal, as these snakes are highly poisonous. The snake poison circulates through the blood and affects the nervous system. First aid for snake bite. Tie a tight bandage a little above the wound to stop the spread of the poison to the entire body. Take the victim to the hospital or doctor immediately.